Ashanti Edwards, the Director for Professional Development at the American Society for Cell Biology. We are pleased to offer Online with LSC as part of the ASCB Professional Development webinar series. Today, our facilitator, Dr. Erin Dolan, will be introducing our featured author for this installment of Online with LSC. Erin?
Thanks, Ashanti. I appreciate your setting this up, and I appreciate everyone taking some time to join us to talk about a super interesting article that was published in LSE by Dr. Gabriela Nagy, and I'm going to call her Gabby. She's actually trained as a clinical psychologist, and so I'm really hoping we can tap her expertise today as we talk about her work on burnout and mental health problems experienced by biomedical doctoral students. She's going to give a brief introduction to her paper that provides an overview for folks who haven't had a chance to read it, or for folks who might have read the paper a little while ago. And while you're listening, what I'd encourage you to do is to use the Q&A function. So rather than the chat function, we're going to use the Q&A function, and that allows us to sort of make questions visible to the audience on the fly. So make sure you can find that Q&A. And then I'm going to go ahead and hand it over to Gabby, who is going to talk about her work on burnout and mental health problems experienced by biomedical doctoral students. Gabby?
Thank you, Erin. And thank you all for attending. I'm super excited to be here. So as Erin said, I am an assistant professor at Duke University. I'm in the Department of Psychiatry, and I'm also in the School of Nursing. And this project was a project that I was involved with a few years ago when I was completing my postdoctoral training. So I'm not the PI of the study. There's an interdisciplinary team of investigators, but really excited to come here and talk to you about this. So just to give you an introduction to the paper, we must first ask, why study wellness and burnout in biomedical graduate students? And so we know that the area of burnout, stress, and psychopathology has garnered recent attention recently. So if you've been paying attention, there's lots of popular media articles as well as scholarly articles talking about environments that might be increasing burnout and mental health problems for doctoral students. And we know that wellness and burnout are an important aspect across all areas of the biomedical workforce, and that prevention of burnout will improve productivity and reduce workforce attrition. Burnout, psychopathology, in this case, things like depression and anxiety and stress are related, but it is not yet known the causal pathways between those. And so when we think about this as it relates to biomedical graduate students, it's really important because we know that biomedical PhD students increased by 25% between 2000 and 2013, while their job prospects after graduation are limited. So we're starting to see an environment that is just ripe for increased burnout and mental health problems. Erin, if you could hit the next slide, please. So in our project, we had two aims. The first was to characterize the nature and scope of problems with burnout and mental health in a sample of biomedical doctoral students. Our second aim was to evaluate associations among burnout and sociodemographic, academic, and mental health variables, also in a sample of biomedical doctoral students. Next slide, thank you. And briefly, our methodology was this. We had 69 biomedical PhD students who were in the School of Medicine, not in the Arts and Sciences side at Duke University. We had one visit where they came in and they did a clinical interview with a clinician who was trained to deliver this interview. And that assessed a range of mental health problems, including things like depression, anxiety, PTSD, ADHD, that sort of stuff. The second thing that they did is they completed a very comprehensive set of surveys that were measuring lots of different constructs such as burnout, the relationship with their advisor, the graduate climate, and we had a lot of constructs across different levels. So if you see to the right, we have some concentric circles, and so we had measures at all of these different levels, starting with the student at the center, their family and friend relationships, the lab and mentor relationships, the program and department environment, the institutional environment, as well as their local community. So that is the sort of summary to this study. So I'll pass it over to Erin. Oh, actually, I forgot this is here. So our key findings, this is the most important slide, and I totally forgot. So our key findings from the study were the following. Half of biomedical doctoral students met the threshold for at least one clinical diagnosis in the past year. Again, those are things like depression, anxiety, PTSD, substance use problems. And importantly, this is higher than the US population and same age counterparts. So we actually were able to compare the rates using the same measures that we used to national standards, national results. We also note that less than half of these students sought out mental health services. The other major finding is that almost all of our participants reported at least some degree of burnout. And when we looked at the things that were related with burnout, the things that came out significant were having thoughts related to dropping out of their grad program, their subjective appraisal of employment opportunities, in this case, maybe thinking that there are not enough opportunities for them once they graduate, their functional impairment due to a mental health problem, and having at least one current psychiatric disorder. And lastly, 2/3 reported thoughts of wanting to drop out of the grad program. So I wanted to note here that dropping out of your grad program is not necessarily in and of itself a bad outcome, right? So some people may choose different options. However, we do think that it's an indicator of burnout and distress that might be happening in their program. And this is relevant because we know that there's a loss of investment from academic institutions when there's high degrees of attrition. So I think, Erin, I think that's the summary of the study. I'll pass it over to you now.
Thank you. I appreciate that. For folks who have been to an Online with LSE webinar before, you know it's sort of a behind the scenes conversation with authors to get a sense of why they did the work that they did, how they went about it, the kinds of stuff that you want to know about a study that you wouldn't necessarily get from reading the article. And so I'm going to start by asking Gabby a series of questions that came to my mind as I read the paper. And I encourage you to use the Q&A function to enter your own questions for Gabby that I will then make available for the audience to see. Just one clarification before we jump in. And Gabby, I don't know if you remember this, because I always have to do this when I talk about my own studies. I have to actually go back and look at the data. Do you remember when you said almost all students reported wanting to drop out to some degree, what almost all was? You remember?
I don't off the top of my head,
yeah, exactly.
But I can look it up.
Oh, sure. And other folks can go ahead and look it up in LSE. It's an online open access journal, so jump online and take a look at that article. And we can also clarify that after the session. So how did you get interested in studying this in the first place? Why did it occur to you to study burnout or mental health in biomedical research students?
Yeah, so as I mentioned, I was a postdoctoral trainee at the time, but I was working with an investigator who was also connected to other interdisciplinary investigators at our med school. And they were able to identify a need of, lots of biomedical PhD students reporting that the environment was sort of leading to burnout and things like that. So what they wanted to do was take a methodical approach to understanding and characterizing what those problems were. And so they were able to secure some internal funds to be able to do this sort of deep dive into this area. So in comparison to, say, for example, like a program evaluation survey that would get sent to all 700 biomedical students, what they opted to do was actually to take more of a research approach and to say, okay, so if we had really strong diagnostic interviews that were interview style, and we created a really strong battery, that would really allow us to explore those intricate relationships. So that's what they've done, and we had a sample of 69 students, and we're really sort of characterizing this as a pilot study, leading us into some other grants that we're thinking about.
Oh, interesting. Yeah, it struck me that it was a very focused disciplinarily on biomedical research and that med school environment, because you actively excluded students who weren't in that particular environment, right? So there's main students on main campus, like arts and sciences
Right.
college students that weren't in the study.
That's correct.
And so I don't know if that was that a circumstance of the funding, or was that because that environment is somehow unique?
Yeah, our funding came directly from the School of Medicine. And at Duke University, there are sort of two different sides of the biomedical space. We have the programs that are housed within the School of Medicine, and then we have the programs that are over in the arts and sciences side. And so we just opted for studying the programs in the School of Medicine.
Great, thanks. And that actually relates to one of the questions from the audience about how generalizable you think these results are to the population of STEM PhDs. And I know you made some comparison to like medical trainees or economics PhDs in the paper. What do you think about how generalizable the findings are to STEM in general versus, or even life sciences compared to biomedical?
Yeah, I do think that there are a lot of similarities, although it really remains an empirical question. I will note that we had a couple of limitations of the study. First, our sample size is 69 people, right? So that's relatively small. And we were only in the biomedical, in the School of Medicine side. And so it's really hard to know whether there's a one-to-one correlation with all the different kinds of experiences that people in other PhD programs might have. But I will say anecdotally, a lot of doctoral students that I've worked with across a range of programs, right, including clinical psychology and life sciences, and even, those in medical school, they know that there are really similar pressures of having little work-life balance, of having a lot of tasks that they need to complete, worries about what kind of employment are they going to have after they graduate, challenges with having to balance having coursework and doing research and maintaining a life outside of that and publishing and going to conferences, all the while experiencing financial stress of not having a lot of funding. Sometimes, programs don't give summer funding, right? And so there's a lot of different stressors that graduate students in general are facing. So while, again, it really remains an empirical question, I do think that there are a lot of similarities across different programs.
Nice, thank you. So a couple of people are asking questions about methods and why it was important to do more. I mean, can you talk a little bit more about what it means to use the methods you did, doing that really clinical diagnosis as opposed to using maybe other survey measures that people who are not clinicians would deploy?
Yeah, so I'll note that we did both. What we did is that we had someone who was trained, in most cases, a clinician, so either a social worker or a clinical psychologist or a clinical psychology trainee, conducted a battery of semi-structured interviews that we tend to use in routine practice to determine whether someone meets the threshold for a clinical diagnosis or not. And in addition to that, we had surveys where people could report on their symptoms of depression and anxiety and burnout and things like that. The reason we thought it was really important is because sometimes we may experience certain things and not necessarily conceptualize it as depression, right? And so it's helpful to have a clinician on the outside to ask really pointed questions that tap into these broader diagnostic criteria. The cool thing about doing a semi-structured interview is that we also have the ability to ask follow-up questions to get more clarity about does it or does it not meet that threshold for a clinical diagnosis. And so the other thing I'll note is that reported in literature, like no one has done these really rigorous structured clinical interviews. And so we thought it was important to really figure out to what degree does that map onto, say, what a clinician would say is going on for the individual.
Yes, you mentioned that you had an interdisciplinary team to carry that out. How did that team come together? And what sort of perspectives were represented?
So the history of the team is that there were three primary investigators for the study. So Zach Rosenthal is a clinical psychologist, and he's in the psychiatry department. He was my mentor. And then Kaf Jarasa is trained as both a psychiatrist and a neurobiologist. And then Chris Nikita is trained as a cell biologist, cell molecular biologist. And so for different reasons, they all have interest in studying burnout and wellness of doctoral students. And early on, they identified that there was this need. They then talked to the administration and were able to get some financial support to be able to study this area. So then the process to determine the methods were the following. Dr. Nikita and Dr. Jarasa would say to Dr. Rosenthal, we think that these are the areas that are really important. Dr. Rosenthal, who's the clinical psychologist, would say, okay, so if you really want to tap into these constructs, I would suggest maybe sort of doing a clinical interview, using these kind of measures. Then Dr. Rosenthal and our team would sort of look in the literature to see what kind of measures are out there in those constructs, come back together and have conversations to really reach consensus around the final battery of measures that were given out.
Nice, that's really nice. So a number of folks have asked about differences in the population, and for example, whether they're male or female students experience different levels of burnout, or whether students of color experience different levels of burnout or mental health issues, or asking about whether, for example, different science cultures might experience things differently. So can you comment at all about that?
Well, not really. And the reason is I think that those points are really well taken, and I'll take some notes in this. I do think it's important for us to look at that. We did not compare results based on gender or race or ethnicity or even program. We sort of did it in aggregate. So I'm not able to report on that at this time.
How do you think that, I mean, could you imagine doing research like that in the future, and how would you think about going about it? Do you have ideas?
Yeah, and I'm going to rely on my clinical and anecdotal experience here rather than what we did empirically in the study. But what I would say is a lot of, individuals who identify as cisgender women report that there's sort of this sexism that happens in their environments, right? This sort of dominance or even oppression of them. And so I think that that's a type of stress that probably could exacerbate this kind of environment. I would say that something similar happens to individuals who identify as racial ethnic minorities. And then you got to think about the intersection of those things, right? And so you hear about things like imposter syndrome, and that environments may not be really welcoming for individuals who may be one of a handful of people from their own background in their programs. And so there's a sort of like minority stress that can happen that I can only hypothesize just makes it even harder to get through your graduate education.
Thank you. Several folks posed questions about why students chose not to seek out mental health healthcare, and whether that might be because it's now seen as normal to be burnt out or normal to have mental health issues, and so they're not seeking care, or if you have other ideas about why that might be the case.
Yeah, and again, like we didn't ask that question specifically. Why did you not seek out care, or why did you seek out care? So again, I'm going to hypothesize here based on my anecdotal experience. One big factor I would say is stigma about mental health problems. Sometimes in these kinds of environments, your worth can be your productivity and how much you can push out. And sometimes it can be really daunting to be able to say out loud to your mentor or even to your cohort mates that, I'm having problems getting the work done, and it has to do with depression or anxiety or different things that I'm struggling with. And so I would say stigma is probably a big factor. And the other thing is that this will depend academic institution to academic institution, but sometimes the services at university settings offer, one session or a couple of sessions. And so I don't know if some people thought, well, I'm not going to go just once, that's not going to be helpful. That's another question too around perceived effectiveness, right, and acceptability of these kinds of services.
Yeah, absolutely. So lots of folks are interested in how we can address this as a community, and whether we need more of a consortium style approach to try and get at all. I mean, you had that lovely stacked ecosystem image where really there's factors happening at so many levels and it's so multidimensional. Are there ways that people are going about that, or is there a push toward cross-campus, cross-unit research to get at this?
I would say that the old view that if someone's experiencing burnout, mental health problems, that they just need to go to therapy, I would say is becoming a little outdated, because I think what we've been able to show is that there may be unique contributions at all of those different levels that actually foster these kinds of environments that are just ripe for burnout and mental health problems. And so I think, all the investigators on the team would say, taking a multi-method approach and targeting all these different factors would probably be optimal. So the things that I can think off the top of my head would be, yes, obviously give referrals to people to get counseling and therapy and medication management if that's something that they're open to and want to do. But the other things are, giving mentors the skills and the training to be able to identify when their students might be needing some support, or even strategies to build cohesion between research lab members, or even trying to train people to have a broader skill set than just applying for academic positions, right? That might reduce some of the stress. So I am not aware specifically of different teams who are developing those interventions. However, that's something that we certainly are interested in beginning to develop here, now having these findings.
Well, and I also wonder if, just from a research perspective, trying to understand how prevalent these issues are in different environments, what the different factors may be at each of those levels. Do you have a sense of whether folks are coming together as researchers to tackle, to try and better understand the landscape of student experience?
Yeah, I would say that this is an area that's getting a lot more attention now. I'm hearing a lot of people talking about this now, and there's actually support from places like NIH and the governing bodies that are really paying attention to what's happening, because more and more you see articles coming out that biomedical graduate students and graduate students in general are really experiencing really high rates of burnout, and that some have even called it a crisis that's happening right now. And so, yeah, I'm very hopeful. I think there's lots of attention and lots of instrumental support behind it, some funding going to study this.
That's really great. That's good news. So we have a couple of questions related to trying to disaggregate effects at those different levels. And I know you have a small sample and you cannot, it's hard to say based on the study design, but do you have a sense of how big a difference or how much the graduate program itself, the climate within the program makes a difference, or sort of how do you balance the influence of the advisor versus the program versus the institution?
What I will tell you is my recollections from doing these clinical interviews. And so I recall that the students who were reporting the highest level of depression and anxiety and stress and burnout often were the students who would tell me, I'm expected to be on call all the time. I'm expected to be answering emails from my research advisor at the drop of the hat, and there are some repercussions, some real consequences if I don't do that. I'm expected to sort of be working nonstop 7 days a week, and the reason for that is that my advisor works nonstop 7 days a week, and so there's sort of that expectation that everyone in the lab needs to be doing so. And so the sort of lack of balance or lack of ability to take a step back and to say, okay, I need a little bit of work-life balance. Those are the things that are sort of coming to mind when you ask me that question.
Yeah, that's sad to hear about. So actually, I have a question about that. How did you manage your own mental health when hearing about students' situations?
Yeah,
if you're willing to talk about it, I should say I should let you choose not to talk about it if you don't want to, especially if we're live on a webinar.
Yeah, exactly. With like 200 people.
Yeah, exactly.
Good news is I'm trained as a clinical psychologist, so I'm really comfortable talking about my feelings all the time.
Thank you. I'm really Undisclosed.
Yeah, no, listen, the benefit is that I have had a lot of training listening to these kinds of stories, given that I am a clinical psychologist. Nonetheless, it's really sad when you hear about people who feel really trapped in their circumstances, like, there's all these stressors and they have lack of control about those stressors, and they're sort of at the mercy of their programs or their advisors. And so it's a challenge to sort of just hear that over and over again. At the same time, I think I could rely on the hope that I have that things will change. And the reason for that is that we did get funding from our institution to study this. I think people are taking this very, seriously. And I think that more attention is being given to this area. So while while it's hard to know that this is the reality, I also have the dream that it's not always going to remain this way. And so I think that's sort of how I just moved through that.
Mm-hmm. That's
And
nice.
I think the other thing I'll say is it was really easy for me to empathize because I also did a PhD and I also went through grad school. And while it wasn't in a biomedical field, there are a lot of similarities, right? So it's really easy for me to empathize with that experience and to provide support in the moment, in the context of doing a research study.
Absolutely. So you mentioned that students sometimes felt trapped. And we have a couple of questions about unique student situations. For example, students who are parents who may feel like they're between a special rock and a hard place, or students who are international students. So do you have any thoughts on that?
Yeah, I would say two different kinds of stressors that I saw specifically with those kind of students. The students who had families had a lot of competing demands. On the one hand, they had to complete their courses, they had to be really productive with research, and at the same time, they had home responsibilities to maybe a significant other or children, such as taking them to school or doing other kinds of activities. And so there's sort of a sense of not having enough time to do all the different things well. The challenge that I heard a lot about with international students is an even more overwhelming sense of loneliness and isolation. And I would say a lot of the students noted this because they had to work so much that they didn't have a lot of time to have balance. But being an international student, you're away from your family. In a lot of cases, you're struggling with a culture of stress, which is just a stress that comes from having to adapt to a new country. So you're trying to navigate what it's like to complete a PhD. You're also having to navigate your own emotions around how do you adapt to life in a different country. And in that, you're missing your family, you're totally away from your network. It gets really, really hard for some.
Thank you for sharing that. So a few folks have asked about whether timeline makes a difference. For example, did you see different stressors for students who are earlier in their degree programs, later, or maybe in the middle where they can't see the beginning or the end? And also a sense of whether there's any work being done on postdocs or junior or senior faculty and their levels of stress and how they might compare.
Yeah, so I think a couple of things. We noted that the ramp up to grad school can be really stressful, and then people sort of get used to the environment. But then when you're getting ready to finish your dissertation and also be looking for new positions, then there's sort of an increase in stress of, oh my goodness, what kind of a position? Are there enough positions? Can I get my dissertation done? That kind of stuff. So I would say in the beginning, at the end, especially, is when we saw a lot of stress.
Those transition points where people are, having to make that move. That's great. Thank you for that. So a couple of folks asked about how willing students were to participate. And I don't know, maybe you could talk a little bit about how you recruited students and what concerns you might have about bias and who's willing to participate or not.
Yeah, I will tell you that everyone that I interviewed was really excited to be part of the study. And the reason for that is that they noted, wow, someone is talking about this. This is like so great that people are paying attention to the fact that we're all stressed out and burnt out right now. So those students in particular were very willing to be a part of this. And, you know, in general, our visits took about 4 hours. So they were very committed to get that done.
Yeah,
At
that's
the same,
impressive.
yeah, and they were able to stick through it. I don't know, right, if there are any differences between the students who were willing and those who did not become part of the study. As I noted, there are 700 biomedical students in our programs, and so that we have a sample of 69. You know, I can't comment on how generalizable that is.
Absolutely, I understand. You got to start somewhere, though, right? If you have to start telling the story, you have to start reporting the data. Several folks have asked about your comment about preparing mentors, which I think is really fantastic. However, most of us are not hired really with regard to anything but our research or maybe our teaching, and certainly not, you know, any kind of evaluation or preparation, right? I mean, no heroes, no villains here, right? None of us were trained generally to be a good mentor. So do you have ideas about how we can better equip mentors, and also what changes we can make to the structure of the biomedical research enterprise to try and provide support for both students and their mentors?
I think you summarized it really nicely, which is that a major challenge is that we don't get training in how to manage labs, right? We get rated on the quality of our science and often the quantity of our output, right? Sometimes our teaching evaluations, but we often don't get evaluated on how strong is the cohesion in our lab, or do people feel like they're thriving or not in our labs, right? And so I really do think that that is an area that we could all do better at, is learning how to manage teams and how to do that well. And I think it's complex, right? Because you have to keep track of multiple projects and multiple deadlines. You have to be checking in with people as they're doing that in a way that doesn't feel punitive, but supportive, giving people what they need, and at the same time, not micromanaging, right? Making sure that everyone in the lab is getting along with one another. And all those things at once can be really hard, especially considering that we who are PIs or faculty have our own expectations of what we need to be accomplishing, like all the papers that we need to be, you know, doing, all the classes, that kind of stuff. And so it can be complex and it can take time. That being said, I really, really heard a lot from the students that if their mentors were aware about some of the challenges that they were experiencing, or even understood the different tasks that they had on their plate and just that developmental stage, that having that increased understanding would probably help to some extent, right? And so my sense is that a lot of PIs and a lot of advisors are really far removed from what it's like to go through grad school. And
Yeah,
so
we romanticize it, or we forget. Yeah.
Yeah. And so yeah, I would say that having some more appreciation for what that environment, that context is like, is really important. And then having some really concrete skills about how to manage teams is really important. And then trying to figure out how you can observe boundaries, right, in terms of work-life balance and promoting well-being. But we also have to be willing to model that ourselves, which is also a challenge.
Yeah, it's super challenging, especially since, you know, what might work as a boundary for me might not work as a boundary for you. I mean, for example, one of the things that I do is I get up very early in the morning, but I don't expect my mentees to do that. It just works for me. But by 5 p.m., I'm done. I can't concentrate anymore. But that might be the time when they're busy working. So,
That's great.
yeah, so modeling the boundaries, but also recognizing that someone else's boundaries might not be the same as yours. Yeah.
That's right. Understanding work styles of the different people in your lab, I think, is really helpful.
So to that end, do you have suggestions, or did it come up with your students in your study, how students can not diagnose, but become aware of their own mental health and burnout, and practice self-care?
Erin, can you ask me that question again?
Absolutely. So several folks asked questions about if the students were experiencing burnout and mental health issues in your study, where, for example, did they get advice on how they can do self-care, or for folks who maybe are want to learn from your study and realize, oh my gosh, I am experiencing burnout. What can I do to either recognize that in myself, given that I don't have access to clinical diagnoses, like a lot of us are really struggling right now with access to good healthcare.
Yeah.
And then what I can do to help myself if I'm experiencing burnout.
Right, right. So our study, one of the things that we did is if we noted that there were students who were really highly distressed, we connected them with services. Luckily, I'm able to report that we had a very, very minimal number of students who were in that category. So we did really thorough assessment to figure out, are they at danger of hurting themselves or others, right? And so we didn't experience that very frequently, hardly at all. And what we did do is we asked people about their ideas of what would be helpful for them. And so we were able to begin to analyze some of this data, and we're getting ready to submit that as a manuscript. But we didn't give recommendations to our sample about what they should do, because this was really more of an observational study to figure out what are the problems. I can tell you what I would say as a clinical psychologist, if that would be helpful.
Yes,
yeah, you're nodding your
I
head.
think it would be helpful. I think there
Okay.
are people who are eager, especially in the time of COVID-19, to.
Yeah, it's really relevant. As you noted, there's a lot of clinics who are not taking new patients right now, given COVID. And so I would say the first thing is, if you're determining that you need a higher level of care, right, that you need some formal services, try to seek out the places that are open. So for example, at our institution, our psychiatry department is taking new patients. I know in our community, there are private practices that are taking new patients, but I work with a community clinic that is not taking new patients, right? And so I think it's a little bit of legwork to figure out where are the places that are taking new patients. So that'd be one. The other thing I will say is there is a lot of self-guided apps and books and YouTube videos and things like that out there on mindfulness. So that is one particular strategy that I rely on for myself to manage burnout and stress. I personally run every day, and I find that to be a stress reliever for me. I garden, and so I think about finding ways that you can step away from the computer and have some time reclaimed just for yourself. The other thing that is really relevant with COVID, and also that we saw in the study, is that people can feel really isolated and really alone, right, in their experience. And sometimes when people experience that, we don't want to talk about it, and we sort of isolate even further. And it gets really, really hard in the kind of context that we're living in to meaningfully connect. That being said, I really want to encourage people to recognize that if you are feeling lonely or isolated, that is a signal that social connection is important to you. Those are part of your values. And so to the extent that that's true, I really want to encourage you to connect with loved ones. And in this time, I've connected with friendships that I hadn't talked to in several years, right?
Oh.
So I think it's now more than ever, people are reaching out to old relationships that they had. And so that is another thing that I would recommend.
Nice. So actually, several folks have asked questions related to, again, what programs can do. And I wonder, are you familiar with the fundamental attribution error?
Why don't you tell me a little bit more?
So this is the idea that sometimes we blame the person we're with for a bad situation. And I wonder if you felt like, sort of how can programs help assume some of the responsibility rather than, for example, blaming any particular people?
This is a really important aspect that you're bringing up. We actually cited in the literature review portion of our paper one study that came out, which essentially looked at the attributions that students compared to faculty members made related to attrition of grad students. And so what we found is that in that study, in reading it, that a lot of the faculty members said, you know, the reason why they dropped out of their program were related to individual level characteristics. Things like they didn't have enough motivation, they didn't take enough initiative, they weren't working hard enough, that kind of stuff.
Yeah, sort of that individual level attribution.
Yeah, it's really about the individual. And then in the study, when they asked the grad students, what are the factors that are leading for you to want to drop out of your program or to drop out? A lot of the things that they talked about were programmatic level factors or even like broader system factors, right? Things like not having enough support to make it through, having to manage all these different expectations at the same time, feeling that they didn't have a supportive working environment with their mentor and other lab members. And so they really located that outside of themselves and more about the environment. So I think, you know, there's probably a synthesis to be had here. It's probably both and, right? I think that probably grad programs select for individuals that are probably a little bit more on the side of neuroticism. I certainly identify that way, right? Like
a lot of people. A little bit about what neuroticism is.
Yeah, I mean, a lot of people go into grad programs and they're the people who are getting straight A's and working really hard and can have perfectionistic tendencies and are wanting to do it all, right? And
control issues, is that have you been talking to my research group?
Which is funny, right? Because like we're not the same institution, we don't have the same discipline, and yet there's something about grad students that tends to sort of be like these really overachieving individuals that are then placed in an environment that places a lot of importance on how much they can achieve and their productivity and doing it well and doing all the things. And so it's just like the perfect storm, right? And so that is why it's important to be able to target both at the individual level and giving people strategies to manage that burnout and that stress and all of that, and also work towards changing some of these environments that make it so high stakes for people all the time to be doing everything perfectly.
Yeah, no, that's a really lovely and nice personal narrative about what a lot of us are experiencing. So related to this, I wonder, several folks have asked about looking at this in postdoc populations or faculty populations. Do you feel like there's an increasing selection for people who maybe are those high achieving folks that then stay on that particular path, and then it just gets worse and worse over career stages? Or do you have a sense of that? Are people studying that?
You know, I'm not aware of anyone who is sort of taking a developmental perspective to figure out how, you know, your progression through different career stages impacts that. What I would say is that there's probably different kinds of challenges at all the different kinds of levels, right? When you're in grad school, you're trying to learn the ropes and you're trying to figure out how do you do this. And then when you're nearing the end of grad school, you're trying to figure out who will hire me? What kind of job can I get? Then you go into your postdoc, and we hear in the biomedical sciences people who do postdoc for many, many years, way longer than what we might do over in like clinical psychology, for example. In clinical psych, you hear postdocs that are 1 to 2 years most often, right? But anyways, when you're in postdoc, you're in this weird limbo where you're trying to figure out how to be independent while still be mentored and get that next job. Then you move into your faculty position, and now you're having to figure out how do you move forward an independent line of research, how do you get your own grants, how do you publish, how do you teach, and how do you mentor all at the same time. And if you're in a soft money environment, you have to all the time be applying for grants to cover your salary. That the pressure is less so if you're in a hard money environment. And then I would say as you're progressing, in some ways, probably you habituate, it gets easier, but probably there's more and more responsibility that you have as you're moving up. And so the challenges are just probably going to be unique to your different place.
Absolutely. Absolutely. That makes sense. So a number of folks have asked if you're going to do any follow-on studies with this population or what you're sort of thinking about as next steps for research. And that seems like a good next step for our conversation. What are you thinking about next? Or
Yeah, our research team has been really interested in figuring out how do we intervene on this. So, this study was really focused on characterizing what are the problems. As we're moving forward, there's two different things that we want to do. One, we want to do longitudinal assessments. As you recall, this study was cross-sectional, observational, one time, right? And that's important to just begin to document that there is a problem. The other thing that we want to do is to be able to track people over time and figure out, as they're progressing through graduate school, are things getting easier? Are things getting worse? Are they staying the same? And then not only that, but there's this question around, well, what do we do about it? How do we change this environment? And as I've mentioned, we are in our team are really taking this multi-level approach to figure out, can there be interventions at all those different kinds of levels that can wrap around and support individuals?
nice. That's actually a really nice segue to our last question. And I want to be mindful of everyone's like Zoom exhaustion. So we're going to actually not go all the way up to the end of the hour. What I'm going to do instead is ask Gabby to close with some comments on if this study is being used to make any changes at your institution, or how are people thinking about using some of this evidence to affect change?
Yeah, so I'll say again, we were fortunate to get some support from our institution, and our different investigators have been able to take this back to the dean and to share with the leadership and the administration our results. And that has been really encouraging for us. That is allowing us to figure out what next steps we can be taking to apply for different grants, and to really be thinking programmatically what kind of interventions to be making. So we're getting lots of traction internally.
That's really nice. Congratulations. That's really heartening. And that's actually one of the things that we were talking about before we got online. Is one of the things I really like about LSE is that it publishes work that not only is really great research. I mean, that the clinical diagnostic work that you did for this study is really unprecedented, I think, in a lot of the work we publish. But also that it has practical applications, and it's reaching people who can actually make a difference in changing what we do in our practice. So what I'd like to do now is ask everyone to switch from the Q&A mode and instead take a minute, just as a post-assessment, to use the chat box to write one interesting thing you learned today. So take a minute and write in the chat, what's one interesting thing that you learned today? And this helps us assess our webinar series. And thanks to those of you who are willing to share. I appreciate it. I see all the comments coming in. That's really fantastic. And then what I'd like to do is end by thanking ASCB for hosting, and Gabby for spending some time with us to tell us about your work, including the behind the scenes and your experience as a clinical psychologist. Please keep an eye out for future LSE and ASCB webinars, and please everyone stay safe and take care of yourselves. I think we learned some great advice here, and I'm looking forward to seeing future work from you and your colleagues, Gabby. Thanks again.
Thank you, Erin, for having me. I really appreciate it. And thank you all for attending. I really, really am thankful that you're here.